Well, last week I talked about this looming medical crisis that I absolutely know is coming, and I have to say it'll affect every single family in this country. The NHS is nearly 5.5 million operations behind. GPs are not giving many consultations. A third of a million people who would have had serious procedures over the course of the last 18 months have not had those operations, and it is leading to something that I thought would happen. And I said last week that my mother had gone in for a knee replacement this time last week on Monday, and that she'd gone privately. She's never gone privately in her life, but couldn't bear the thought of a very, very long wait. And today's Daily Mail ran a story on the front page saying that people were paying up to £20,000 to go into hospital to have very important, urgent heart procedures. HCA Healthcare and Spire, and they're the two biggest owners of private hospitals in this country, both report that in terms of heart operations, they've seen an increase of 20%, and on some neurological conditions, including injections in spines and those kind of procedures, they've seen a 30% increase. Well, some people can afford to go privately and have those operations. For others, we hear they're even beginning to take out loans. But of course, the great danger here is we finish up in completely the opposite place to where we were in the 1940s, that we have a health system where those with money or able to take loans can get the medical procedures that they want, and those without money or access to money find themselves on a huge waiting list. And that would be a society of haves and have-nots for health. It would be incredibly divisive and indeed, I think, very, very unfair. And I'm saying all of these things in that I believe there is going to be this winter a huge health crisis, and it's going to lead to a lot of very, very unhappy people. I'm not saying these things just to be negative. I'm saying these things because the government needs to wake up to this PDQ, and let's try and find some sort of solution. So one idea that I want to explore tonight is, could the private sector help save the NHS? I'm not talking about privatising the NHS. I know that'll be out on Twitter already from some of those who don't listen to what I say but jump to very ready conclusions. But I'm asking, is the private sector capable of lifting a huge burden off the NHS? And if it is, how do we fund it?
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.